I mean, from the very first call, it was pretty easy. We immediately did a Zoom call actually, which I thought was kind of nice. And he basically walked my wife and I through the whole plan, and to give the backstory so people kind of know a little bit about my family. I've got 2 kids. I'm like your typical husband, wife, 2 kids. Don't get sick very often. No broken bones, knock on wood, so we're pretty healthy. And, for years we watched our fees just go up and up and up. And so, when we did that first call and we finally got to the price, we're like, oh my God, this is pretty good. And so, so it was definitely, it was awesome. And they made it very easy, to switch over. The whole process was very, very simple. In a plan that was a good plan, but it had the high deductible. So if anything really bad happened, then we were going to be on the hook for I think 6 or 7 grand, something like that. And so that was one of the things that I liked most about your plan was the $1,500 per incident deductible. I think that works out really well for a family like myself, which very rarely has any big issues. And so we are now, so we were about to do 1275, I think is what it was. And I remember going back just like 2010. I mean, we were paying like $400, $500, $600 a month, and the costs have just gone crazy. And so to think about spending $1275 a month every month, I mean, that's more than like a country club membership. And so but by switching over to this plan, I think we're on the plan that's I think $875 for a family of 4, and it's the fully loaded and has all the bells and whistles, and so we're saving basically $5 grand a year. So I mean, just like that. I mean, so which is great. I wish we could spend do a vacation with that money, but right now everyone's kind of indoors. We're staying home. At the stock market, I'm going to have that thing doubled in a month.
Yeah, there you go. There you go. Awesome. Awesome. Well, there's so many things you can do with an extra $5 grand a year, and trips are one, pouring it back into your business is one, putting it into the stock market is one. There's a lot of things that you can do with it. Okay, great. Well, have you had the experience of using the plan yet? Going to the doctor, calling Teledoc?
So my wife has a couple of times with the kids, just kind of with some of their stuff, and it's been fairly easy. They did a doctor visit. The billing, she had to kind of figure that out, which was very easy for the most part. Everything got paid, and so we have. I mean, like I said, we're pretty healthy. We've been on the plan, I think, for what, like 6, 7, maybe 7, 8 months, something like that. Mm-hmm. And so it was just kind of just basic stuff. I haven't had to personally use it yet, with again, knock on wood, but I do. I guess I should take a physical here pretty soon. So
yes.
I mean, that's a no-brainer. I mean, it makes sense to talk about that. So I'll usually, as I'm going through a list of questions, I'll sneak that in there. So, hey, I'm just curious, how much are you paying a month in healthcare? And so that is something, I mean, because again, it's $5,000. I mean, we only have a cap of 16K, and then it's like, okay, well, now you guys have saved me 5,000. So I feel like the cap is 11,000 now, because of that. And so, it just, to me, it just makes a lot of sense. So with the recruiting, it definitely has helped. And it's just one of those degree of separations because, and I'll be honest, when I first, and I actually like to tell this story to people that I'm trying to attract, when I heard this, that you guys were trying to do this or that EXP was trying to incorporate this, I was like, oh, that's so cute. That is just adorable. Like they are trying, but I'm like, there's no way it's going to be a good plan. And so that was, I think the big surprise was when I made that call and I heard the plan, I'm like, wow, this is like actually a really good plan. And so to me, that like, so when I talk to people, I can kind of come from that place, you know, that like, that's my story. Like, I was like, wow, this is, you know, a great plan. And so, so I, you know, I just, it's, you know, just one more little thing to pull out, and you never know what's going to cause somebody to switch, you know, that everybody has their reason. But when you look at our overall plan, I mean, we're really trying to take care of health and wealth by giving, you know, all, I mean, all the stock awards. I mean, it's crazy. Like everything that this company is doing is just, it's such an amazing thing for the agent. And, you know, I mean, I've only been here for 2.5 years, and to see the accumulation of stock awards and all this other stuff. And then with the healthcare, it's just, it's been a great experience here at EXP. And it's innovative partners working with other innovative partners. Say to anybody watching this, you know, video, definitely give them a call, compare the plans to each other. The doctor network was actually pretty impressive. You know, what was interesting is that, you know, through Obamacare, you know, we weren't supposed to lose our doctor. Well, I was one of the families that we lost our doctor, our total plan, everything was completely taken away. And so we had to switch networks. And so, you know, which was sad, because, you know, the doctors that we had, that had our children, those were our doctors. And so we had to leave them. But, and this is, you know, I don't even think I've told you this, so it's part Margo, was we actually have access to a lot of those doctors again. So, and that's through this network, because it's broadened it out to so many different doctors out there. So, you know, I mean, it's kind of a no-brainer. I mean, it's definitely worth the 15-minute, you know, Zoom meeting. I mean, it doesn't hurt.